back to another inspiring episode of Beyond Shodh. Here we are in the middle of the series presenting to you the third episode of my startup story. I am your host, Dr. Sonia Balyan, and today we have the privilege of delving into the startup journey of Dr. Shriram Raghavan, a true luminary in the field of synthetic biology and entrepreneurship. In this episode, we are in for a treat as Dr. Raghavan not only share his incredible journey, but also provide us with the detailed vision of his two groundbreaking startups, the eLive Biotherapeutics and Natural Nutrition. Dr. Raghavan currently serves as the Senior Vice President at Genome, India's pioneering company offering synthetic biology as a service. With over 2 decades of experience, Dr. Raghavan has played a pivotal role in building 6 startups in the life science sector, operating across 28 countries worldwide. But that's not all. Dr. Raghavan is also the founder of 2 other groundbreaking startups. One, eLive Biotherapeutics, based in California, is dedicated to developing the world's first programmed live biotherapeutics for lung cancer, and the other, Natural Nutrition, focuses on the providing vegan meal replacement as convenient food options for millennials globally. Prior to his current role, Dr. Raghavan held the position of Vice President at Evolva Biotech, a Swiss-headquartered synthetic biology company, but his contribution extends far beyond individual companies. Dr. Raghavan actively supports over 60 startups along the east coast of India, offering guidance and mentorship. He advises numerous technology incubators such as the Golden Jubilee Biotech Park in Chennai, KIIT and TBI in Bhubaneswar, among others. Not stopping there, Dr. Raghavan is also involved in shaping the future of biotechnology education. He is the part of AICTE committee working on formulation of a model curriculum for Biotech courses in biotechnology, aiming to introduce entrepreneurship to students at an early stage. Recently elected as an executive council member of ABLE, the Association of Biotech-Led Enterprises, Dr. Raghavan continues to make significant contributions to the biotech industry in India. With an impressive educational background, including a master's in biochemical engineering, MPhil and PhD in computational system biology, MBA in International Business and certification from Harvard Business School, Dr. Raghavan brings a wealth of knowledge and experience to the table. It's truly an honor to have Dr. Shriram Raghavan with us today, and we are eager to dive into his insights on the future of synthetic biology and entrepreneurship in the biotech sector.
Thank you so much and welcome to Beyond Shodh. And we are very grateful to you that you take out time and join us and allowed us the opportunity to know about your startup journey. Thank you so much, sir.
Thank you, Sonia, for having me here, and I really appreciate your efforts going extra beyond the mile in terms of spreading this information to the next generation. Really appreciate and hope you do many more of these episodes. My full support to you.
Thank you so much, sir. So, sir, to start with the interview, could you please tell us a little bit about your backgrounds and the area of research and how your passion for science transformed into your startup journey?
Okay, so that's a kind of an unplanned journey, if I am to put it that way. I basically started off from a computational biology background, including my early work at the US with large pharma majors on the kinase inhibitors long back, and later on moved to customizing multiplex diagnostics and aiming to create solutions for low-density microarrays. At the time, it was very important, and later on, including drone fuels and many of the advanced areas of life sciences. But other than that, I also have my own areas of interest, including SETI, which is Search for Extraterrestrial Intelligence, and finding Earth-crossing asteroids that probably wiped out dinosaurs before, trying to mine those asteroids, including exploring deep cosmos. I'm also part of those kind of deep science initiatives. But in all these, the common thread is that I wanted to see a quick translation to usable and commercially sustainable solutions. And hence, I thought entrepreneurship was a viable route to that, as it can support radical and lateral vision. And it allows thinking without getting entangled with complex, institutional hierarchies. So that took me to 6 startups, 4 success and 2 failures. Okay. Right now working with 3 startups of my own and supporting 50 other startups in dozen incubators, tech incubators across the country. more so on the east coast of India, from Tuticorin to all the way to Jorhat, where entrepreneurs need a lot of support.
So, sir, can you please give us a brief introduction about your current startup that you are part of?
Yeah, so I will come to that probably after, in terms of why I probably entered into computational biology, and then I'll come to that, maybe if you allow me in that particular order. So initially I started from a computational, background, especially mainframe computers and logic gates, etc., which is also going to be important part in terms of what I'm going to say for eLive in terms of circuits. And of course, if you look at in terms of how the field is going to evolve in the future, we are looking at a lot of, people talk about AI, but I see quantum computing is also going to play a very important role in that area. But I think the basic paradigm is going to be in terms of treating the disease holistically and not just identifying one target. So we're going to see polypharmacology, reverse pharmacology, computational, alternative medicines or computational biology, and so on and so forth. So that's how it's going to evolve. Now coming back to from that particular level to, what about live biotherapeutics? So today, if you look at any disease, there are only two options to treat a disease. One is a targeted, non-targeted therapy, and another is a targeted therapy. Now we all know about non-targeted therapy, basically small molecules, you bombard the disease, but you also get side effects. Now in targeted therapy, we have antibodies, we have gene therapy, we have cell therapy, and all of these are highly targeted therapies. But the problem with all the targeted therapies is that it works only on responders. Now, what are responders? Like those who have the receptors, those who have the right ability to react to that particular antibody or whatever they are giving. Now, if you look at the case of lung cancer, only 1 in 5 patients are responders. So what do we do for those who don't respond? So sadly, that's why death cannot be avoided. Now, on the other hand, non-targeted therapies like cytotoxic compounds are usable for all the patients, but they create adverse reactions, as I said before. So patients sometimes are not even able to bear the side effects. So the idea is to engineer a microbe with genes to produce a drug that could be produced at the site of disease. So it is a targeted therapy, but it is carrying a payload of genes, but it will produce only at the site of the disease when it's needed. It's kind of on demand. So imagine you call it the Zomato or, kind of on demand order. You order food when you're hungry, you'll get food at your doorstep in 20 minutes or 30 minutes. That's the kind of thing. So now, we are actually sending whole drug factory inside a patient's body. But remember, this particular approach of so-called live biotherapeutics is what we call, and if you want to program it, it's called programmed live biotherapeutics. And by the way, eLive is called engineered live biotherapeutics, is what we call it, which is different from giving a, simple bacteria to cure a disease. But there are 8 challenges in it, which I will also quickly touch upon now, so that, you are very clear with the challenges. So the first is you have to select the right microbe, because if you are going to send a microbe inside a patient's body, we should know what kind of microbial host we are going to put it in. So that should have some safety record. So in this case, we identified E. coli imbecile 1917, which is used as a probiotics in Germany and in many parts of the world. So now I've got a bug. Okay. Now what are you going to do with the bug? We have to engineer metabolic pathways into this bug to produce a small molecule. Okay. Now that could be 1-step pathway, 2-step pathway, but in our case, we chose a very challenging area of engineering, podophytotoxin pathway, which is 16 steps. So imagine E. coli bug in E. coli imbecile 1917. We should have the right tools, right engineering abilities, and we have to engineer a 16-step metabolic pathway. So that's the second part. Now when you engineer a complex pathway, third is we have to ensure that only the right small molecule, right end molecule comes out and not other byproducts, because every single byproduct impurities could actually influence our body in different ways or side effects. So the fourth is we have to ensure that the final compound, even if it is produced inside the bug, it should come out of the cell. So for this, we were the first in the world to find a transporter. We had to engineer a transporter on it. So now the bacteria can secrete the drug. So even after all these things, now comes the most important question where I started with the computational background is that now we have to engineer 3 different circuits in this. That's where the programmed engineering part comes in. So what are these 3 circuits? First is we need to have first set of circuits for sensory circuits, so that the bacteria has got an ability to sense the state of the disease whenever it goes to that particular site. It should know whether the disease is on, it is off, what is actually happening there. For example, we can make it sense like nitric oxide, pH, various changes in biomarkers there. So there are abilities to detect these. Once it detects, what should the bacteria do? It should take a decision. The decision is to start all the production or expression of all the genes and the component small molecules, right? So that's the start switch. Once the compound is produced, the biomarker dies out, the cancer cells are dead, then what it should do is it should switch off the, drug production. So then the side effect is mitigated, right? So it's because it is acting locally. So obviously you should have, again, the sensor should activate and it should have a stop switch. The biomarker sensor switches, then starts a stop switch. And then the third kind of circuitry of switches are nothing but biocontainment switches, which means if the bug escapes to any other area of the body or even outside the human environment, it should decide to kill itself. It's kind of, autolysis kill switch that it says, okay, for example, I've come out of 37 degrees plus this particular physiological pH, I should kill myself. Or from one lung, or let's say from another liver it goes, condition changes, it should decide to kill itself. So let's say we have engineered all the circuits. Then comes another challenge. The next challenge is, how are you going to administer this to a patient? Obviously, oral has got its own problem. Giving it through IV has got its own problem. So we thought, let's go with a nasal route, because for a lung cancer, we chose lung cancer. So we thought nasal would be a better route. But here again, there are a lot of challenges like particle size. We have to put it with the right particle size, 1 to 5 micrometer. We have to optimize it, of course, with a lot of third party players around the world. We actually managed to optimize the right particle size. And then the seventh challenge is the dosage. How much of colony forming units are you going to give? So in this case, after a lot of trial, we identified 5 into 10 to the power 6 colony forming units per ml. And then the last and the eighth challenge is that, how long is this bug going to stay inside a patient? We decided a weekly dose. So later on, subsequent questions I'll cover as to why it is a week-long dose. But, the idea is like once the patient takes the nasal dose, it stays in the patient for 7 days, and then it comes out automatically and safely without any other problem in 7 days. And the peak action will be for 4th to 6th day. So these are the broadly 8 challenges that we had some solutions, but still a long way to go.
So, sir, is there any way that if it is taken inside the body, we can monitor from outside, maybe based on some sensor and all that, whether it is doing its job and what stage is in the treatment went?
Exactly. So obviously, the simple answer to that question is we have to constantly monitor the patient's biomarker profile on a regular basis, weekly basis, etc. Simple biomarker profile in terms of metabolites, biochemical intermediates. We should have a control in terms of what is the patient producing in terms of the regular basic metabolites plus this additional metabolites. So typically a weekly, invasive as well as non-invasive test may be required. The kind of very mild blood prick we should be able to have, but also breath analysis. In this case, because of nasal route, we have to look at what kind of metabolites, but it's going to be a complex monitoring of all of these because we are dealing with terminally ill patients. So all of this may be really required to monitor the prognosis.
So, sir, so what is the status of this vision? So are you able to achieve that, the administration to the patient, or it is in the testing phase?
No, this is still in the preclinical stage, but I'll tell you in terms of where we are at the right stage and what makes this approach very unique. So if you look at amongst the 8 challenges that I mentioned, engineering circuits and 16-step pathways are the first time that we have done in the world. Nobody in the world has done. That itself is a big achievement. And to treat a disease, for which a patent is also awarded in the US now. This is fundamentally a US company. And this is very unique because we can control the microbe from an external handle as well. So for example, as you rightly asked in the previous question, if something goes wrong, I'll just give a simple example of an Arabinose-switch. For example, if something goes wrong, we want to activate or deactivate something, we can actually make an Arabinose formulation, make the patient inhale, and then we can actually get things done because they'll have an Arabinose response from it. It's just an example that I'm giving. But if you really look at a broad, I don't want to talk about a broader area here. So in terms of the cancer and what we are trying to solve. Right now, if you look at in terms of small cell lung cancer is the area that we're working on. Lung cancer, there are 2 kinds of cancer, small cell and large cell. For the non-small cell or the large cancer cell, there are different therapies. But for small cell lung cancer, for the last 20 years, there is no new drugs that has come, no new therapies. It is the same old conventional chemotherapy and radiotherapy. So what is the problem there? Initially, the SCLC, small cell lung cancer patients are diagnosed pretty much late in their disease. They come to the hospital, okay? And initially, when they are coming to the hospital, they are given 1 month worth of very intense chemotherapy doses and immunotherapy in responders. And this 1 month dose is so intense that they are not able to bear the toxicity and they are sent home for break-in therapy for 2 to 3 months for them to recover. Now, this is where the problem starts. Now, during this 2 to 3 months, in 70% of the cases when the patient comes back, we see a relapse of cancer. Now, when the relapse happens, what is the problem? We can't use the same chemotherapy that we used in the primary regimen at the starting stage, because the resistance would have happened to that particular drug. Now, the options that are left is basically use topotecan, but sometimes topotecan doesn't work, and immunotherapy doesn't work in all the patients. Now, that's when the patient is completely left, to die a very painful death. So on one hand, there is a toxicity-induced side effects, and then there is a second hand, there is kind of cancer-induced, pain. So the patient dies in about 6 months. Now, this is a very, very sad and very difficult, painful death. We all know we are going to die one day, but the quality of life until the point of death is valued by every single humans who are alive on the planet, because we value that very much. So what are we trying to solve here? Is that the idea is to look at, during the break-in therapy, at home, when the patient is sent home, we want to administer this engineered, probiotic using nasal route without any clinician support. The patient can take it, via nasal spray. And once the bug goes in, the first question is how does a bug go into the lung directly? What happens is the bacteria has got a chemotactic motor, which is 1,500-fold more specific to hypoxic core of cancer. Now, that's a phenomenal differential selectivity, because then small cell cancer, if you remember, they actually form a solid core, in the lung. And lung is an organ which is rich in oxygen, right? So it's very difficult to find hypoxic regions in lung. Lung is filled with oxygen most of the time. So the small cell lung cancer forms this small hypoxic cores, and the bacteria, almost like a laser guided machine gun, it just goes with such a rapid pace into the hypoxic core. It drills a hole and lodges itself. And that's when the biomarkers start sensing the lung cancer related small cell lung cancer markers. Then the genes are activated, the drug is produced, it comes out, let's say it acts on the cancer cell. Let's say the cancer cells die. Now, when it dies, till now, what is actually happening is these cancer cells have evaded the patient's immune system in all their life, because that's why they are able to proliferate, right? Because the immune system tracking is very, very minimal there. They have completely evaded it. Now, when these cells die, along with the bacterial proliferation, it sends a complex signal to the immune system. Now, here is a problem. Now, the thing is, cancer patients in the initial first month, they are completely bombarded with the chemo. Most of the cells have died. One of the bad, adverse, negative impact on the chemotherapy is the myelosuppression. In the sense, it acts on the bone marrow and it kills your ability to produce immune cells, right? So you have very, very little set of kind of immune cells left in the patient's body. But with that set of immune cells, because remember the patient is on break-in therapy, so there's kind of recovery. So these immune cells are slowly produced back from the bone marrow. And the little bit of death of cancer cells as well as the bacterial, death, etc., proliferation at that particular area then starts emitting, very interesting signals. And the immune cells comes chasing after now. Till now, the whole area has been completely, evading immune system. Now the immune system, with whatever left, it starts acting. So this is kind of dual action. So the bacteria produces a drug, as also activates the immune system to the particular core. Now, once the immune system comes, cells come, natural killer cells or, T cells, etc. They do two things. One is they actually kill all other remaining hiding cells, in terms of small cell lung cancers. Plus, it will also kill the bacteria, which is what we want, because we want at some point the bacteria to be eliminated from the body also. It's kind of dual action, both beneficial. And eventually, what actually happens is that the cancer cells are not, the relapse is not happening. At least we have ideas to minimize the relapse. So after 2 to 3 months, when the patient comes back, for the checking again, at least the relapse will not be there, at least in majority of the patients. Now, the goal for this particular thing from FDA is that even if 18% of the cases, if we can, just in 18% of the cases out of 70% that we can prevent relapse, FDA is willing to give a fast track approval for this. So that is an intense pain and, suffering that is actually going on in this area. So right now we have engineered the circuits, the pathway is ready, transporter is ready. So the safety test, it has cleared it. So right now we are under efficacy studies, and after that we'll have to go to IND to, obviously do a trial. But the main point is one needs to raise a lot of funding to really go through that.
How you are proceeding with the fundings? Government funding or mainly the US funding, or you are also setting up eLive here in India?
So at this point of time, we had actually made several approaches to the Indian government agency, and unfortunately, live biotherapeutics is not is still an area of active consideration for funding, because obviously you need to have peer review, you need to have some expertise in it. It's a kind of new area. So administering probiotics is kind of therapy. Live biotherapeutics is second line. Programmed live biotherapeutics, engineered live biotherapeutics is third, and programmed engineered live biotherapeutics is somehow a very, very complex area. So right now, the company's profile is largely in the US, where we are actually seeing a lot of investor support. But the unfortunate global geopolitical situations also impact funding. And at this point of time, we are still having some promising investors, but it is going to take some time. We are prepared for the long haul, because this is a kind of very radically blue sky concept that we are trying to do. It's going to take some time.
And so for example, you are currently focusing on lung cancer. This way we can also focus on other chronic diseases and develop very specific interventions for their treatment also.
Yes. So the places where, of course, this particular mode of programmed live biotherapeutics can be applied in vastly different areas. But given the complexity of how you engineer the organism, how you construct the circuits, etc., ensures that we focus this on terminally ill patients who have very limited choices. I'll give you an example. If you look at cystic fibrosis, you look at COPD, you look at some of these on the terminal stages where all the therapies are failed, targeted therapies are not working. The patient is, suffering through intense pain. It is at that stage when, at this point of time, when there is no other therapy, obviously then the insurance companies will also be willing to fund such a therapy, because at the early stage, insurance companies may not be willing to take such a risk, because this is still an experimental phase, at least in the next 10 years that we see. But wherever suffering is there is no other alternative option, and when there is a terminal disease with no other options, this would be a very good choice in terms of going forward.
So, sir, during your journey, another startup is from natural nutrition. So, what exactly is the vision of natural nutrition?
Okay, so that's a great question, Sonia. So, if you look at today, from a plant-based perspective, every single millennial youth or person, boy or a girl, is all fascinated with vegan diet. Now, vegan diet it can save 88% of carbon dioxide from the planet. It can save at least 90% of water. So in terms of vegan, the millennials are aware that it's going to save the carbon footprint and also the water footprint by up to 88 to 94. But the problem is, if you look at what kind of alternatives that are available to millennials in terms of food consumption for vegans, of course, we in Indians have a so-called this thali meals, right, which we eat at restaurants or at even home. We have diversity of food. For Indians, we take it for granted. But globally, for example, if you look at Scandinavia, or if you look at, people living in, cold countries, for instance, the food diversity is very, very poor. If they decide to become vegans, for example, imagine someone staying in Finland, Norway, Scotland, Denmark, all of those kind of Iceland, all those countries, if they wanted to have a thali meals, they can't do it, right? They don't have the vegan varieties that you and I sitting in India have. So what they were all requesting, because since we were working in European companies before, is that they wanted to explore vegan alternatives. Now, from a vegan alternative, if you look at today, what is available in the West is basically like Soylent, Huel. There are limited companies where, they take soy protein. They focus either on protein, or if they say moringa is important, they make moringa and they make it into powder. They don't have this concept of diversity. So what we wanted to do is we want to stay vegan. We want to give diversity, we want to give balanced nutrition, and we want to ensure that it takes care of 1/3 of your daily dietary requirements. Now, for your daily dietary requirements, for example, during COVID times, Sonia would have recognized that you need zinc, particular composition. LIG used to provide that particular thing, and people, started taking LIG-based tea, etc. So instead of becoming a fad diet, like keto diet, or concept-based diet, we thought we'll give a balanced nutrition, keep it vegan, make it diverse. So keep this is one part. The second part is, recently, there was a publication there was actually, you can Google this publication also, something called American Gut Project. What they found out in this American Gut Project is they did a 10-year study on most of the North American citizens. And they found out that you need to eat 30 different fruits and vegetables in 1 week. In 1 week, you need to eat 30 different fruits and vegetables to keep your gut microbiome balanced, in a diverse fashion. Because your gut microbiome makes who you are. And if you need to read, because these gut microbiome controls 4 different information superhighways in your body, your gut brain, gut immune, gut endocrine, and gut, the other access, information highways. So to keep these information highways intact and to maintain microbial diversity, you need to eat 30 different fruits and vegetables. Now, that is point number 1. Point number 2, you need to also consume 6 different parts of the plant, like root, I think shoot, flower, seed, stem, leaf, and all of that, right? Now, if you really carefully monitor your diet for 52 weeks, maybe 1 week you may eat, 2 weeks you eat, but 52 weeks, week on week basis, it is impossible for any human beings in our present lifestyle to really structure this because we are all, kind of hurried pace of life. So what we thought is that we will scientifically, make a composition of this 30 different nutrients, 6 different parts of the plant, and ensure that we give, 1/3 of dietary requirements, including vitamins, minerals, trace elements, and naturally flavor. No chemicals, no premixes, nothing. Everything is natural. We will actually also add a natural vanillin to it from the vanilla beans. Everything we keep it natural, and we want to ensure that the 30 different fruits and vegetables are there, 6 different plant parts are there, plus meet the dietary requirement of 1/3 of a person with all the vitamins, etc. So that was the basic concept today. Scientifically, that we had put together, we want to analytically validate the fingerprint chromatogram, make it very scientific, and that's when, now we see a lot of interest picking up, especially from the Scandinavian and other countries who are actually buying this product. But I think in India, it's going to take some time because Indian youth they are actually spoiled with a lot of choices at this point of time. But globally, that's the concept that they are heading to.
So what all products this natural
nutrition. So actually, other than this vegan mix, what they are also trying to do is they are trying to use the same composition, scientifically validated composition, in different formats. Let's say I put together this kind of a powder and give it to you. Maybe you and I will drink. Suppose I actually go to your children and I actually give them. They may or may not eat it because they may not know the value of it. They want snacks, right? They want spicy snacks. They want some muscatesta, what they call materials. They want, some people like all sweets, etc. They want ice creams, they want chocolate. So the second important challenge there, Sonia, what we wanted to solve is the presentation format. How do we take it to the next generation? Because, you and I may know the value, but that's not the main problem. We have to solve for the next generation because if you look at Sonia ji, 50% of all our young girls are anemic. That's a very alarming survey that I think ICMR will publish very recently. It came out for some states. 50% of the next generation girls are anemic. And, it's very difficult for us to really cope up with, bringing their hemoglobin levels back to normal. So the presentation format, what we thought is how do we take it in a different state? So one route is 3D printing. So we are working on 3D printing different shapes, sizes, making it, spicy, making it tangy, making it sweet. So automatically we are trying to now work with many institutions to make a 3D printer to print out, sit at home, give a 3D print, and you will get this in whatever format you want. The second option is obviously use it in pancakes. Use it in your, waffles. Use it in your regular idli dosa batter. You use, your omelette mix, for instance. So we thought, how do we formulate this in a way that you don't present to them, you completely hide this from your children, okay? You won't even show it to the children, but you add it to your mix. They will not even know what they're eating, but they will only feel the taste of a waffle or a pancake and all of this. But internally, they'll be able to get all this nutrition without the anti-nutrients interfering. So we are also working on those presentation formats to take it to the next generation.
So this company is also India-based, or it is again?
Yeah, this is an Indian-based company because this is where the idea is to also support farmers because we are working with close to 700 different farmers in the Western Ghats of India who are actually giving us organic produce products which are free of pesticides and all of this where we have tested it, and then we want to incorporate this on a scientific basis into these products.
So much of work, sir. So
yes.
Much of diverse areas and the very diverse vision. So I'm wondering how you manage all these things and together, because you are also associated with the training programs and you are also supporting most of the startups, and also you are providing your guidance through these incubation cluster and all. How do you manage and what exactly motivates you to do it all?
So one thing, Sonia, is like people's enthusiasm. Many times it actually pulls me because especially on the east coast of India that I was referring to, there many times I see entrepreneurs, they are even struggling to communicate in a fashion that you and I do, but they may have wonderful products in their hand which have got therapeutic properties or nutritive properties, or it can solve a problem. But unfortunately, they may not know anything about setting up a company, how to take it forward. So the idea is to, many people actually go and work in hospitals as nurses. Some people go to temples and do charity work. I thought, I asked my question this to myself, why can't I do this as a service based? I don't take any money for it. I do it totally on a kind of a, I wouldn't call it charity, but I would call more of a freely supporting the ecosystem. So that, this, because obviously those entrepreneurs will have nothing to pay me, even if they're going to charge any money for it. So what motivates me is their energy level. They keep texting me, they keep, asking me different questions. And every time they come back to me, that energy motivates me to give them more, subject to, time availability of what I can give. But I think there are some challenges also that keeps me active, because some of these challenges are, not just the scientific challenges, but also funding challenges. We have regulatory challenges. We have some of the other things also, which we thought, why don't we work as a team? Because I always believe that if we work as a team, maybe we'll come out with a different solution rather than single person working. And finally, it also makes me think, because the questions that these people ask, it makes me think many times, can we do it better in a different way? It's kind of larger. So I see all these entrepreneurs that I support as a larger part of my own family and my own team. That keeps me motivated and good.
Great, sir. So, sir, in your journey, what are the major challenges that you have faced and conquered?
If you look at any startup, not just life sciences, if you look at, startup is all about two things. One is solving a problem and ensuring it gets desired market acceptability. These are the two important, points for a startup. Now, for this, again, we need two other things, just other than the workable idea or workable solution, is that first, it's a good team. Okay. Most times, ideas will fail, but a good team will carry on despite odds to ensure success with alternative ideas. And secondly, it's clear visibility on the market. You see, most times, Sonia, the problem is scientists are very reluctant to become a salesperson and sell their solution. Now, we can't rely on others to sell our solutions, right? So, shy away from selling and making people understand our solution, then one has to recognize one's limitation and decide their career accordingly. Is entrepreneurship right for me is a question that one needs to ask. So, for example, if you take our own case, from Genome's perspective, not eLive, from Genome's perspective, from synthetic biology startup, we didn't seek any investor money in startup till date. It's been more than 5 years. And we are yet offering synthetic biology solutions to the whole world with a world-class, solution. The revenues are close to $1 million each year. So each year we are having a $1 million revenue, and it's profitable company. This is the first time a synthetic biology company is profitable. We are not simply giving a simple one enzyme biotransformation, etc. We are whole complex engineering pathway, multi-step pathway we are engineering, what takes some other scientific teams probably years together. So we are doing this year on year, $1 million revenue. We are showing 10 to 15% profit margin. With our team, we managed to do this even during COVID times of 2 years of lockdown without any break in our revenue. Primarily all because of our commercial skills that we are reaching out to all peoples in the world, around the world. So we because of our ability to sell our solution was very effective. We had some good people for that. So that is the key thing from a scientific perspective if you really want to, have a startup.
So if suppose any student have just idea, so what is the exact roadmap that he should proceed? Maybe what exactly are the steps to proceed? If you just have an idea in your mind and you don't know whether it has the potential to transform into a startup or to make some useful products.
Yes. So the first thing is, if you really look at from, we basically, if you have to write up kind of bullet points, on the mind. So the first thing is I'm going to talk about certain things which we do not teach in school or college so far, or even in family. So the first thing that, one needs to look at, startup, which is not being taught in school, is finances. We are never taught how to handle money, at all stages of our life. If you carefully go back to your own schooling or college. Remember, this is not to be confused with an accounts or auditing or an MBA. They are just academically, you're learning something about economics. No, this is purely about how to manage money, multiply money, and beat inflation and returns. So for example, if I'm going to seek money from some sources, let's say if I need to create a budget for what I want to do, whatever proof of concept. If that budget is about 50 lakhs, 1 crore, grant is separate. But if I'm going to take somebody's money, even from relatives, friends, etc., if I'm going to take 1 lakh rupees, I should be able to answer 2 questions. I think any person who wants to start should write it down. How am I going to return this money? Am I going to give 1 lakh as just 1 lakh back? Because then nobody is going to give me. They will put it in bank FD, right? So if I'm going to get 1 lakh, I should be able to at least return, 3 to 4 lakhs, maybe 5 lakhs, preferably even 10 lakhs. So how many times can I return the money back? Number two, when will I return the money back? Now, obviously, they need a time frame, right? You have to return the money back in 5 years, in 10 years. These are the two primary questions that first somebody should write down. If you make a budget for how much it is going to cost, because money is everything at the initial stage. How much money do you need? Whom are you going to get it from? And when will you return? And how much times are you going to return? Very simple questions. After this, let's say someone is going to give you that money, either through grant, through investment, through equity. Then the next thing is the people skill. So this is again big problem, Sonia, because if you really go back and analyze, all of our academics are focused on your individual excellence. You getting your PhD, you getting your doctorate, you making your first author publication and all of this. And suddenly we expect, you to become an entrepreneur. And entrepreneurs, what is entrepreneur? Fundamentally people skill, right? And we expect these people to carry on with a team. The team itself is a big word. So if you look at today's situation of millennials, I really see, the marriage rate is declining. And even those who are married, I think the divorce rates are very alarmingly very high globally, and also in millennials is very dangerous. They say, sir, I'm incompatible with my partner. I cannot take this person anymore. And all just probably even 1 or 2 days, they get irritated and they become very angry. So imagine if that is the case, how are these people going to carry a team? And remember, when you are going to have a team, you will have people, elder to you, or you will have people younger to you, you will have people of your age, you will have a variety of people. A team is a team, right? You don't see age difference in a team. So you have to have very important people skill of how to live with differences, still carry on a team. Every human being will have a flaw. So how to work with that flaw. So that's a very important thing to make this particular idea succeed, because you know that you're going to have all these weaknesses. So that's number two. So the third thing is, let's say you got the person, you got the money, you built this idea, you got the solution, is marketing. Now, as I repeated before, biotech folks, especially biotech people, what I have seen are notorious for what? They are notorious for explaining one unknown with another unknown. For example, I have not seen anybody successfully explain Ramachandran plot to me, either at school nor at college. You ask them to explain Ramachandran plot, straight away they will use a two unknown word called phi and psi or whatever the angles, right? They will use the term called peptide bond. You and I can understand. Imagine an investor is not going to understand. It is our responsibility to make the investor understand what Ramachandran plot is, how is it going to make money to it. Biotech people will not help you with this. So marketing idea is very, very important. So we start to train students, even when they are at school or college, to make them explain this concept to their grandma. We said, okay, go to your grandma, explain to her what you said. I will speak to her on the phone so that I know what she understood from what you said. If your grandma can understand, your investor and other people can also understand, because they will not have a scientific background all the time. So that's marketing, right? The next thing is stop loss. What is stop loss? So when you are playing a game or when you are playing entrepreneurship, any activity, you should know when you are going to go through a loss. This is a very important decision-making step. You have to be trained to identify this. At which point are you going to say, okay, this project or process is not going to, take shape. I have put in everything. I put in all the effort. I think at this point of time, I should stop working on it. Or maybe I should convert this into something else so that, I don't chase. See, because many times, Sonia, because of our ego, we will not be able to do it. So that stop loss is very important area. And then the next two important areas is basically handling legalities. We don't teach how to fight a legal case in a court, because that is something which moment you say someone is going to file a case, you're going to be dragged to a court. Immediately you will see, all the middle class families where we come from, we get agitated, right? Parents will think otherwise, society will think bad of you. They will always think there's some problem with you. The moment many of my own startups, where I'm mentoring, many of them, they have made 5 crores or more revenue. I've seen big companies come and file a case against them. So this is a normal thing, but we have not trained our entrepreneurs how to handle a legal case, courts in India, courts abroad. It's not just fighting a case, but also budget for it, because each hearing globally, if you go, it may cost you anywhere between $5,000 to $25,000 per hearing. So we should know how you are going to handle this legal battle if someone is going to come after you. We cannot be taking this lightly. And then the last final thing, Sonia ji, is that, there are 3 kinds of laws that we, ask life science entrepreneurs to be clear. State laws, central laws, and global laws. Now, if you look at state, in this case, laws are basically rules. So if you look at states have enacted many rules, including, pollution control norms, etc., electricity norms. Each state has got varying norms, which we don't educate, but we are expected to, people to know this. And in central government, there are certain norms like biodiversity norms, IDSC clearances, RCGM clearances, other than the regulatory one, even for research, while at the startup stage. And then thirdly, if they are going to work on any product that is touching on global bioconvention, there are certain rules in terms of which country you are sourcing these particular genes from. You should be able to pay royalty to that country and so on. So I think we educate, based entrepreneurs on a case-by-case basis, whomever required these particular laws also. But I think the state and central government laws are common because people register company, but they don't even file an ROC filing. They don't even know what to do. So we actually train people in all these areas, those who really want to start up. First, we ask them to write these things down and we ask them, questions one by one. As and when we go, we actually teach them.
Great, sir. So, sir, because you have expertise and also you have experience here in India also and in US and other countries also, what do you think that the current ecosystem that we have in India in supporting STEM startups, is it adequate or what exactly are the loopholes and the areas which government or how can we improve those areas, and what are exactly these areas which we need improvement to support?
Yeah, so that's a great question. So a couple of points that I've monitored based on me sitting on the other side also helping them secure investments also is that if you see largely in the last few years, majority of the life science startups are focusing on medical devices, apps, and mostly IT driven startups. Why is it that they are focusing on it? That is because, you can get this to market faster. The team is fundamentally an engineering team. The life science component or, your possibility of being stuck with a biotech person is very minimal. You only look at healthcare professionals for a very minimal thing. And I think largely driven and run by IT professionals or maybe IITs. Okay, so that's something that people are trying to focus on. But that's, how many, variables are you going to wear? And, do you think all variables are very, they are giving right readings? Are all the variables are really worked on it? That's a different question. But I think that's when people are actually working on. But if you really look at serious problems, they're still left as problems. Nobody is trying to solve those problems. And I think that is largely because there is a risk-averse capital. There is a dearth of risk-averse capital in the country. Unlike other, global markets. For example, even eLive. Even from a government perspective, if you talk about programmed live biotherapeutics, I think people are a little cautious because it is genetically modified. You're programming something, you're going to put it inside somebody's human body. And, people don't want to take the risk here. Okay. People want to take measured risk because they want, so you can't please all the people all the time. You can't be correct all the time. Right? People want to be. But in other countries, I think that's not the case. So because of this, we don't have, capital. We can actually find these risk takers, with calculated risk. I'm not talking about completely uncalculated, illogical risks, but calculated risk takers, people who can back them. We need that kind of a capital. It's not grant because grant alone cannot, take it all the way. You need those kind of people who can fund such ideas. That is there in other areas, but not in terms of the life science area, because life science is where the maximum challenges are. But unfortunately, even after COVID, you see in COVID, they did not fund those who really want to discover something. If you look at vaccine is basically inactivated, heat inactivated or somewhere inactivated vaccine, or people are working on periphery areas, like oxygen generators or gloves and all of this. The core problem, Sonia, if you always see in life sciences, we will never touch that. We will only work on the side because there is, it is easy, right? So that is something which you see we are really shying away from it, primarily because we don't have the money or risk capital to back it. The second problem that I see is that in terms of scale up or manufacturing, even if you look at medical companies, some startups need 100 devices, some startups need 200 devices. I don't see very many manufacturing support ecosystem that can actually help these people make scale up, and go to the next stage in the commercial stage. If you look at, not many of these are successful commercial companies in terms of selling it in Amazon, selling it globally, etc. And also the problem is that we import many components from China, from Korea, etc. That is because we don't have component makers in India. So even though we call it Make in India, unfortunately these components are still coming from other areas. So we are not fully, self-reliant in those areas. And the third important thing, Sonia ji, as you rightly, said before, and we are also discussing, is the talent. If you look at, on one hand, we are churning out a lot of people with degrees. People are smart. People know everything. But the question is, in a startup, we may not have much time to train them into this area. We want people who are ready-made. Now, people who are ready-made, people who are knowledgeable into it, they're going to be expensive. Startup will not have money to pay. And if you're going to look at youngsters who are interested into it, they may need a lot of training. So obviously we need big institutions who can make these people job ready. Be it core life sciences, be it experimentation. Many students, many times people have seen a demo, but that will not help you to really work on it. If you're going to come and learn the experiments in a startup setup, they may not have the money, they may not have the resources, they may not have the time to really do it. So in terms of industry-ready talent for working in startup is very important. The last and final point in those talent is that, if you look at how does the ecosystem view, if you look at the problem is, everybody, most of the parents would want to work his or her daughter, kind of a reputed institution with a, high salary, monthly salary with a great paycheck. That's what you read in the news, etc. Someone got a 1 crore salary, someone got 2 crore pay, etc. But in that kind of environment, imagine a boy or a girl joins a startup, probably salary or not even no salary, say I'm going to solve a great problem. I don't think the parents, the societal ecosystem is going to, this mamajis and chachajis are going to take it any lightly if they come to know about it. That's a serious dampener that we also see, at least in India. We don't see the same mamajis and chachajis coming and comparing, in abroad. When some boy or a girl decide to, work on programmed biotherapeutics, solving the problem, saying, hey, I want to solve this problem. They are not answerable to anyone, but here they are accountable to 100 other people at home.
So, sir, is it possible that you can put up all these issues to the government or the big industries so that they come up to solve these issues?
So there are 3 different stakeholders, Sonia, here. One is government, yes, exactly, because government is doing the bridge. I think specifically if you look at what Biotech has been doing, I don't think there is any other department in government of India, if you really look at it, not even Department of Space, where they are actually giving this grant. Imagine if you and I want to start up in space. I don't think we are going to get a grant like this. I think we are happy to have this Department of Biotechnology and this Biotech at least giving these grants to startup grants. So that I think is what government can do. But what government probably should also do is to look at a scale-up and manufacturing facility for all these startups, because if they are granting something, they should also look at a path for them to scale up. And also the regulatory path, because obviously you can't fund something and say, I don't know. For example, you're funding a GM crop, okay, genetically modified crop, and if you say I'm not going to open any, trials for GM crops, then obviously then you cannot fund that, right? So you have to have that kind of things met out within the department. That's what I think government is trying to do, but it's going to take some time. I don't think it's going to be solved tomorrow. But if you look at industry perspective, large industries are actually, setting up industry-ready kind of courses. They are trying to work with universities these days. They are trying to conduct these courses. But the problem is they would try to absorb the candidates themselves. That's what large corporation does. They would probably want you to be a protocol boy or a protocol girl. What do I mean by a protocol boy? I give you a protocol, you follow the protocol, 1 ml you add the solution, you will add. You will not think what solution you are adding, why are you adding 1 ml, what happens if you add 2 ml, should I add it to the sides of the test tube? You will say, you will not say why I should add it to the side of a test tube, you are not going to question. So essentially you are basically a humanized robot. If you look at most cases, they may want this kind of a perpetual repetitive area. So they are training for it, that's fine with it, that's also kind of a job. But in startup, what happens is you have to think every single step because you are trying to create something new, right? And that's when suddenly there's a huge disconnect. Now, if the boy or a girl starts to question this particular, disconnect, tries to go into that mode, not everybody can afford this luxury. The problem is even if, let's say, if I'm financially settled person, if tomorrow, if my parents are going to keep me a lot of pressure in terms of, I need to find a prospective marriage in alliance. I need to, ensure that, you should have a home, you should have your own family when you're 30, because you remember, Sonia, see, we are actually having the set rules. And I don't think that has really changed family setup. If tomorrow the family says, okay, Sonia, do whatever you want to do. I'm not going to question you. You are free to make your choices. Eventually 20 years later, I'm going to come back and say, what problem did you solve for the planet? Have you seen any parent really ever, give you this kind of a blank check, open checkbook, with that freedom? Until that happens, like what happens in abroad, it's very difficult for us to, really motivate the youngster because, as I said earlier before, this is something which government or industry cannot solve. The individual, the youngsters are able to take the decision. But when they have to go back to home, right? When they go back to home, they will be deterred from taking these kind of risks. Even, simple thinking at some point of time, they are being deterred is what we are observing. This is something which is very difficult for us to solve as a society because we are not risk takers.
As rightly you are saying that the role of family. So, sir, how do you see your family supported throughout your startup journey? So,
in a way, in my family, they were not, very happy with this particular me taking this particular deviation. Nobody is going to be happy, to be very honest. So eventually I had to carve my own line, which of course they are not very happy. So society was thinking, kind of nuts. So obviously they'll be comparing you always with, as they say in memes, etc. They actually make this funny stuff, saying they will always start comparing you with, some well accomplished people. They will never allow you to be you as a person. So I think many times in those cases, in my case, what I did is I had to really chart out. I'm saying, look, ethically, morally, as long as I'm not, doing anything wrong, as long as I'm within my realms, as long as I ensure that if there's a financial responsibility, I will ensure that the financial responsibility is fulfilled, but I should have a, freedom of space of what I want to do. And I think that is something which I had to carve my own rules, which people did not like. Obviously, there was a lot of protest and there's probably very little support, but I had to, really march my way through in my case. But I don't think not many people would have that kind of vigor to really march on their thing. But constantly there would be a pressure, even if not in the family, someone from the relatives, someone from the guest. Even today, for example, they will ask you, okay, where are you working? If I'm going to say, if it's a SaaS startups, if it's IT startup, even a startup that is fashionable, right? But if it's going to be a biotech, the next question is, are you going to be a unicorn? Because they've heard this word somewhere. Next question that they will say is, okay, are you going to make $1 billion? No, look, come on. I mean, not everybody is going to make $1 billion like that. So the problem is people have forgotten that problem solving is important. Money comes after. But I think, that's something, that's because we were initially a kind of society, Sonia, where we were going after money. But I think that particular evolutionary habit is still stuck with us. So from a society perspective, from my own family perspective, it was not a very easy journey is what I would go back and recollect.
But hopefully you will, change their, what can I say, जो सदियों से चली आ रही है, you must be the person who make the evolution in their thinking so that the younger generation would have a little bit more relaxed.
Yeah, so what I have done in that area, Sonia, is that in certain times what I have decided to do, because after my stay in Harvard and then kind of work that I was doing there, when I came back here, I decided to focus on, one simple thing, like whoever is a kind of aspiring entrepreneurs, there are aspiring minds. That answers to the question that you asked back, what motivates me. There are a lot of people who actually come to me in terms of the aspiring minds. I thought, I will rather than changing certain views, which are preset, probably written in stone, instead of wasting time there. So I thought I'm going to work with aspiring minds, because obviously there's very limited time in one's life. This is a very small window that you get in your life before you become too old or when you're too young. In this particular window, the idea is to inspire as many aspiring minds as possible, ensure that collective wisdom is built to solve global challenges. So that's the area that I'm at this point of time, and I think I'm getting some reasonable response around the country in that area.
Great, sir. So, sir, through your journey, what are some key takeaways from your experience, and what key advice you want to share with the young entrepreneurs who are interested in to start up their own journey?
So the summary point, if someone is really wanting to look at it, is that if you go back in history, which I think I projected during that meeting also when I actually met you in Delhi, is that if you look at the economic data from AD 1 till 1700, ancient Bharat was actually holding more than 50% of global GDP, which means entrepreneurship and business is known to us. It is in all our genes, I would say. So we know what that is. We know global trading. We know how to create value. The next 1,000 years is going to be about technology entrepreneurship. It's not just simple entrepreneurship, but technology entrepreneurship. This technology entrepreneurship is important to solve the new challenges that nature is going to throw on us. And that too in biotech, there is an additional layer of complexity that goes to solving the challenge as well as, starting entrepreneurship, etc. Because we discussed several clearances that is really required, which is challenging. On the other hand, if you look at many people in Gen Z or Gen X generation, as they call based on the year of birth, they're financially secure. Many people are financially secure. They don't need to go after the difficulties that you and I had to really face when we were actually in college. So they're well poised to take this challenge, especially in biotech when they are coming in. They should recognize that technology entrepreneurship is a way forward, and they should probably think in terms of how to solve these problems in a broader context, not go back and then look what their parents did, what somebody else did. And you don't need to necessarily take that path. And one should also recognize that entrepreneurship is always risky. It is not mandatory. Let's be very clear that entrepreneurship it's not for everybody, because you have to have a clear vision of when you're going to take somebody's money, how are you going to return that money? So that is something which should be drilled into people's mind. And in terms of the potential route of exit is what we call it. So that is something which one should be very clear. And based on that, I think one should be able to jump on this, especially those who can and those who are willing to take the risk, because there are days when you will go without any money. You may be probably on the street. You may be reduced to nothing. You should be mentally prepared. I think it's important to give that picture to the youngster before he or she comes in. And after all this, if you can still take it, that will be great. But this is the right time where India is really poised to take on this challenge. And I think we, as a country, with the given demographic, dividend, we are well poised to take on global challenges. That much I am confident.
Great, sir. Thank you so much for your vision, sharing your vision and your story to our audience. And definitely, whosoever will listen to this interview will get the core messages from your journey. Thank you so much for giving us the opportunity to feature your story to our audience. Thank you so much, sir.
Thank you so much, Sonia, for having me, and I really wish you all the best in terms of going forward, in terms of conducting many more of these shows so that you can disseminate information very effectively. You're doing a wonderful job. Good work to you.
Thank you so much, sir.